Hello? Hello, hello, hello. Hello, hello, hello. We'd like to get started again, please. It's my great pleasure to introduce to you Arnie Milstein, who's professor of medicine at Stanford and the founding director of the Stanford Clinical Excellence Research Center, which is a collaboration between the schools of medicine, engineering, and business. And he's also chairing a whole bunch of things. You've known him for much longer than you've known me. But he's the medical director of the Pacific Business Group on Health, as well as the chair of the steering committee for the Integrated Healthcare Association. And I'm very pleased he's going to speak to us now, and we're going to go right into it, because as we've seen this morning, we've got an agenda that's just back to back. So Arnie, please.
Thank you. When I was brought to Stanford, it was explained to me that my job was to create a research center that would generate practical knowledge that could be used by healthcare systems to improve. And I decided to translate the word improve to disproportionately weight the affordability of healthcare. And it's really based on my having spent 6 years as a congressional advisor, my beginning to realize that if you want what is basically a country that forever has been prided itself on low tax rates, if you want to preserve good care for people who are in the bottom half of the income distribution, we need to more heavily prioritize things that would lower the cost of great care. So that's what our center's been focused on. And I thought I'd just share with you a few of the things that we've been working on. But maybe about 4 years ago, I heard a really interesting presentation on campus by a faculty member at UCLA named Keith Holyoke. He studies kind of really good ideas that end up making a difference in over 100 to 200 year decades. And what he said is that it's the better ideas come from people who can take metaphors that are completely distant from what they're trying to work on and identify the ones that translate. And for any of you who sort of, Einstein's been quoted, there was something about Einstein's ability to sort of be on a bus and look up at a clock tower and translate that into the theory of relativity. That was what we call a really distant metaphor, right? Clock tower, bus, the theory of relativity. It's a big jump, but he was inspired by that kind of a metaphor. And Keith basically says if you look across things that really made a difference, that's inevitably been the case. So that's always been my inspiration for how I, invest our limited resources to uncover useful things that might lower the cost of great care. First of all, can you raise your hand if you could explain what that picture is a picture of? Right? That's the Edison tube, and I'm going to use that as the kickoff for my talk today. About 5 years ago, the X Prize Foundation said they would give $5 million to whatever engineering team could build a car and demonstrate it. It got more than 100 miles per gallon. It would be affordable to a average American family and would be very safe, score very well on the safety tests and be comfortable and hold 4 people. And all the big companies, General Electric and Siemens and IBM, and the winner was a tiny engineering firm in Lynchburg, Virginia, no one ever heard of. And when they read the interviews of these people, they basically said, well, we basically said, what are 2 or 3 fundamental ideas on the prize? And in this particular case, the insight was, everybody was thinking about battery technology, and they quickly figured out that batteries were way too heavy relative to what they did for your miles per gallon. And they said the key is coming up with a phenomenally light and safe car, and then having a really tiny gasoline engine to power it. And that actually was the answer. What they did is they were looking at the frontiers of knowledge and critically evaluating it, and then coming up with a winning solution. And now they're the big winners because now all the big companies are licensing their ideas and beginning to develop some cars that are actually rated. Some of these electric versions of this are now rated close to 300 miles per gallon. So that's, let's start with that. So let's now translate that to healthcare. So, let's see if and people in the White House, I basically trying to say, what is it you want the healthcare system to do? And this essentially is what they wanted to do, and jobs that are validated with proof of longer life. And then, most of the relative to the last 50 years, we have to continuously find efficiencies every year, year in, year out, like that Edison 2 team did.